But we do want to talk about the Colorado's flu season. Going to be a little bit like normal. That's what the data says. But COVID could certainly be a wild card. And doctors say you don't want to wait. Now is the time to start thinking about getting the updated flu and the COVID shot.
That's right. But if you're trying to get the updated COVID vaccine for your kid, you might have to act quickly. 9 News reporter Evan Krugel explains how those doses are difficult to find so far this year.
As the first signs of fall begin to appear in Denver, doctors at Rocky Mountain Hospital for Children are bracing for an uptick in sick kids.
We're getting into viral season, as we call it. Yep.
Dr. Neil Sella says those trips to the ER can often be avoided with a couple of quick fall pokes.
Working in the ER, I'm a big fan of prevention. Prevention goes a long way. It's better than dealing with the acute illness. In the case of COVID vaccine, you're talking about preventing hospitalizations.
But getting a pediatric COVID vaccine is proving to be difficult this year. Walgreens and CVS pharmacies both are out of stock in Denver, and some pediatricians say they're low on supply too.
Many of those shipments are just starting to arrive at providers' offices this week.
State epidemiologist Rachel Herlihy says one reason is that the latest round of vaccines were only approved by the FDA in the past few weeks.
So I would say the vaccine is coming. We know that it can take several weeks after FDA authorization for the supply to become ample in the state, and that's because the vaccines are being ordered and shipped right now, and in some cases are really just starting to arrive in healthcare providers' offices.
In a perfect world, maybe it would have rolled out right at the beginning of the school season, school year. But a little late, better than never. It's going to be a tough winter, so getting that on board is definitely recommended.
Dr. Sella is hoping availability will increase in the weeks to come and recommends getting any brand available the minute you have a chance.
An analogy for me is if you're going to go run a 5K, don't you want to train a little bit before it? COVID's coming our way. Don't you want to train the immune system? It might not be perfect. You might get sick, but I think your chances of getting severely sick are a lot less.
And that was Evan Krugel reporting. We did reach out to Walgreens and CVS to see when they might get those pediatric doses in stock.